As part of advocacy efforts to improve voluntary blood donation in order to cope blood-related challenges within the country, young volunteers from the University of the Gambia Medical Students Association were at the Edward Francis Small Teaching Hospital to donate blood. Mohamed Jeba is the Health and Gender Minister of Unigamsa. He highlighted the critical contribution volunteers make to national health systems, adding that such donations are part of their awareness efforts to ensure the availability of safe blood for transfusion.
We have a responsibility. There is something that we can also do to contribute towards our healthcare system. And just like they mentioned, this is what we can do to contribute and improve the healthcare system. So we are very happy to do this today. The importance of blood cannot be overemphasized. There are all sectors in the hospital needs blood, from the labor wards. People speak about maternal mortality nowadays. So we just like to say the leading cause of maternal mortality is postpartum hemorrhage. And one of the things that you can do to help people that are undergoing such a condition is through donating them blood.
Regular, voluntary, and unpaid blood donors such as Unigamsa are crucial in ensuring adequate and reliable supply of safe blood. According to WHO, low units of blood were collected in the Gambia from voluntary, unpaid donations, which creates a gap between the need and the availability of safe blood across the country. Safi Abia, Program Manager, National Blood Transfusion Services, Ministry of Health, thanked the association for the initiative, which she said will save lives.
We have almost highly dependent rate of relative donors, which is not the safest pool of donors. So if you have young people that are coming out to say we want to give out blood, we want to help in sensitizing to solve the problem of lack of blood in our facility, we'll say thank you to you all for taking your time and coming out to give the gift of life. If people are willing to come out to give this gift of life, we always say thank you and we always appreciate those people. Blood donation, as I always say also, is something that can help the person giving out blood by one, helping enhance the production of the person's red cell, help the person from anemia, prevent heart attack, heart diseases, and cardiovascular problems, because one of these leading cause of these conditions is iron overload. So if blood donation is helping you balance your iron level, it's directly helping you in preventing these conditions. At
the blood donation center, volunteers are screened for infections. Then the blood is taken and placed in a blood bag, safely kept. Dr. Megan Kell, Hematology Consultant Laboratory at Edward Francis Small Teaching Hospital, expressed delight over the move by the association, whilst calling on others to emulate them.
That blood transfusion is an essential component of healthcare. It's particularly important in bleeding patients and patients needing surgery. And the Gambia, unfortunately, is very reliant on family and relative donors, and there are very few voluntary donors currently in the Gambia. And so days like this can really improve access to blood transfusion for our patients, and I think can really help improving awareness of the need for blood transfusion and sensitizing our population in the Gambia to the need for blood transfusion.
A similar activity also took place at the Police Intervention Unit in Kanifing. Jankey, GTS News.